Children in Swaziland are severely affected by the many challenges posed by poverty, recurrent drought and food insecurity. These interlinked factors are accentuated by the impact of the country's 26% HIV prevalence rate, the highest in the world. Jama Gulaid, UNICEF Representative in Swaziland, was in the UK recently. I asked him to outline the current situation for children and UNICEF's work for them in Swaziland.
Swaziland is a small country. It's a very complex country because it has some of the most difficult challenges associated with the HIV/AIDS epidemic. If you take a look at the HIV/AIDS global epidemic, what you find out is that Africa is worse off compared to other regions. Other than within Africa, then Southern Africa is most affected, and then within Southern Africa, Swaziland comes at the bottom. We have got the highest prevalence rate in the world, and it's quite daunting in that respect. When you have an epidemic that affects almost 40% actually 42% of the pregnant women who are attending antenatal clinic, you can imagine the burden of disease that you have. The impact of the disease is enormous. It's reflected in the mortality pattern. For example, almost 50% of the under 5 mortality is from HIV/AIDS related causes. Life expectancy rate in the country has gone down from about 60 years to about 33 years in a decade. So it's almost one half of what it was 10 years ago. Then on top of all of that, you've got many children now who are orphans or extremely vulnerable because they're living in poor households. They are sometimes even the head of the household, children looking after other children.
What is UNICEF doing to provide Swazi children with the health care and protection they need?
We already have collaborative work with the Well Food Program, and we have a network of community-based structures called neighborhood care points. And these facilities or structures, community-based structures, host children from the community, especially the ones who have no other place to go. They come in and they get at least a meal a day, have organized a sort of periodic visits of health workers to the neighborhood care points so these children can get routine checks, and those who require referral can be referred to health facilities. Those children get deworming from there. They get those who are also in school age are now being mainstreamed from the neighborhood care point into the school system. In the past, you just have to go around the neighborhoods to try and find the children. But now we have the neighborhood care points. It's already a good place to locate the children, gather there. The other thing that we have done at the neighborhood care points is just to bring in some materials like classrooms, materials that children can use as you would if you were in a daycare center. Things to play with, pictures, letters, pencils, school in a box sort of. So there's a lot more that needs to be done, but at least we have gone far enough in some of the responding to some of the things that we have discovered. We have been bringing in water to the neighborhood care points so that children would have clean water, and we're putting up toilets so that they have sanitation, so that as they move to the schools, which we're also working with, they've already adopted some practices that will help them a lot.
Are there any particular projects that UNICEF UK is supporting in Swaziland?
Yes, I think one of the main areas of support that UNICEF Swaziland has been receiving actually comes from national committees. The assistance that we have received really covers a number of areas. The impact mitigation, that's the support that we have for children. Even in getting some of these neighborhood care points established and to train people and work with them in providing care for them within the communities benefit substantially from the assistance from UK.
What's the next major challenge to combat in Swaziland, and what is UNICEF doing to face it?
Yes, there are a number of challenges still, and I think the primary challenge is HIV. With HIV, we made progress preventing the transmission of the virus from the mother to the infant, but the area where which is lagging behind is the prevention, just primary prevention, preventing the young people from getting infected. This is an extremely challenging area that I can unfortunately not say that we have achieved much success at all. And we are not alone in that respect. I think it's a global challenge, but within Swaziland, I don't think we have done any better in dealing with the primary infection. Primary prevention is the key, and that is one of the new areas of emphasis for UNICEF, for the United Nations country team, and even within the government. This is not going to be an easy task, but we already know that. But whatever that was done before was either in small in scale, and when you're dealing with something of the magnitude of tsunamis, because you cannot just have few sandbags and expect that sandbags will stop 9-meter high waves. And that is just about the analogy I can give you is with the HIV AIDS. And I think in Swaziland already we have started. Just to give you an example, last year we conducted a midterm review of the program. That's about half year into the 5-year program. We review it and we see if we are on track, if we want to adjust the program and so on. And we recognize that prevention is an area that needs a lot more energy and attention. So we know that a lot of the people that exposed to the risk after birth are the young people. And so the longer they remain HIV negative, the better. Most of these children, where do you find them? You find them in schools. Even though there are some children who cannot go to schools because they cannot pay for it, the majority of young people are still in schools. So what we've done is to try and focus and energize our program that deals with prevention by trying to reach all the schools. So last year, this campaign, which started last year, has reached half the primary schools now in Swaziland. And it reached with a package of interventions, primary prevention of HIV and prevention of violence against children, physical violence and sexual violence. And we found out that sexual violence is a major problem. And unfortunately, it contributes also to puts children at great risk to sexually transmissible diseases, including HIV. Huge problem. But if you get the children into school, that is already a first step. Second step is to ensure that they stay in the school. Third step is to try and change the school environment, establish some policies that will mitigate not mitigate, but also prevent some of the violence that exists there. And also then reinforce some of the good practices some of these young people have. So the prevention program that now we're pushing at the schools really will be expanded to the remainder of the other primary schools for this year. And then will intensify for it to have the necessary effect that we are looking for. And I'm very, very excited about the campaign that is being launched here in the UK, Unite for Children, the prevention focus. And you're right on target with your 3 elements: information for behavior change, services, and on protection. And the protection, of course, for the children against sexual abuse, protection against violence, protection for themselves from risky behaviors and habits.
To find out more information on UNICEF's Unite for Children, Unite Against AIDS campaign, go to www.unicef.org.uk/prevention. This is Tiana Rounds reporting for UNICEF UK.